All right, so this time I actually remembered to delete everything before we started so I could hit record straight away. Okay, so yeah, we got Ryan on here for anyone that hasn't been on here before. He's a physiotherapist, and yeah, he jumps on and does these lives for you out of good heart and to help you guys out to prevent any sort of injuries or issues. So yeah, Ryan, just a real, because there's a couple of people on here who haven't seen you before, just a real quick intro on yourself.
Yeah. So I am an ex-PT and physio now, and spent the first part of my career working in elite sports, so in like rugby league, basketball, a little bit of netball, and kind of got sick of the sports life, and now kind of live in the heart of Sydney, doing just a lot of like different corporate type people, but still really enjoy the sports. I physio for a local rugby team, and my big passion is trying to teach a lot of the stuff I learn in elite sports with rehabilitation and pass it on to the general population, or for you guys that are in the military as well. So
yeah, sweet. Awesome. So yeah, for this chat, we've only got a 30-minute window. So we're going to try to bang out this topic. And then if we've got time at the end, we'll do a little bit of a Q&A if you've got any questions, if we've got some time. Okay, so yeah, the topic that we're going to go over tonight is lower back pain when running. I do hear this a fair bit. And yeah, for me, it's usually a pretty black and white thing. That usually comes down to a very common issue. But Ryan, I'd love to hear yeah, your take on it and some sort of ways you'd go about assessing if like the problems that someone's got.
Yeah, so there's for me there's two, like just with lower back pain in general, like besides actual big issues, there's two big things that jump out at me with lower back pain. The first one is your back is it a stiffness thing or is it a weakness thing? And I think I do harp on a lot about that quite a lot. So is it a stiffness thing? If you remember back to high school, when you did the sit and reach test, you guys all remember doing the sit and reach test. You got the little box and you have to push the box up as far as you can go. If you can recall, if you're someone who does get lower back pain and you can recall you were really shit at the sit and reach test, chances are that your lower back pain could be because of a stiffness issue. And I always say, ideally for everybody, I would like everybody to be able to touch their toes in a seated position. Ideally, trying to get about 6 centimeters in front of your toes is like the optimal and above. But definitely, like I try and I work with a lot of office workers, so they're very stiff, but I try and get everybody to at least touch their toes. So if we want to do a quick mock now, I'm going to drop the camera down and we're going to go, everyone jump down.
Oh no.
Everyone jump down. And feet down, hamstrings straight, and I want you to try and touch your toes with your hamstrings, or if you can, try and get 6 centimeters above as you go and move forward.
I'm not warmed up.
You'll be fine, bro. You're an animal. So that's just a super simple thing. It's just testing how tight are we in our hamstrings, but also how well does our back bend forward as well. If you are really, really stiff, what tends to happen is if the hamstrings are really, really tight, it tends to make your back go from having that sort of nice curve in the back there to becoming flatter. And the problem with having a flat back is that we do tend to put a lot more stress onto our intervertebral discs. You always hear those words discs. They're always talked about really nastily, like every time you hear disc, everyone winces in pain, but it's actually really, really common to have a disc issue. So like a bulge disc, if we were to get the 5 of us now, we were to get an X-ray on our backs or a CT scan, chances are that one of us would have a bulged disc and we wouldn't even know. So it's not a proper bad thing until it becomes an issue with the disc. But so that's one way that you can get a little bit of pain with running. You can be super stiff in the back, and if you are, mobility is a huge thing for getting you much better. So things like making sure you do a good warm up with some dynamic stretching, which I'm sure Brody harps on to you guys about in the group chat, and making sure you do some activation exercises for your glutes as well, because the glutes are a super important way of stabilizing the actual back as well before we go running. And when we're on a single leg, that is running. Running is just single leg hopping over and over and over again. And if we're on a single leg, we literally have to have that stabilizing muscle in the glutes activating if we don't want to get back pain as well. So having good strength through the glutes is really, really important with running. And if you can see when you do a single leg, if you can see that your knee, you get those knock knees, your knees turn in or the knees look unstable and they're waving around everywhere, chances are those glutes aren't activating. And that could be a massive reason that you're getting a lot of back pain as well. So stiffness in the back, no stabilization through either the glutes or your core muscles. And your core muscles are the muscles underneath your six pack. Underneath the six pack, you've got another muscle. It's a big, almost like those old school corsets that women used to wear back in the day that go right around you. And what it does is it actually stabilizes the spine, helps stabilize the spine. And if you don't have a good, strong core, that can also cause a little bit of pain as well. And then the last one, and I've left it to last because I think it's probably the most common way I see, is that you've got the opposite, which I actually have. So a perfect example here, and I need to work on it all the time. So you have a pelvis that tilts forward too much. So you've got that big bow in your back there like that. And the problem with that is that we're putting a lot of stress on the joints of our back. So our actual back itself, those vertebrae are jamming up every time we run. And a lot of the time it's because we have a weakness through a tightness through our hip flexors. So it's not even in the back at all. Our hip flexors are quite tight, which actually pulls the pelvis forward and jams up the back. So if you're someone like that, if you're like me, if you get a jammed up back like that, and you're getting a lot of pain with your running, it's always a good one to have a look at your hip flexors and make sure that your hip flexors aren't really tight. And if they are, do a really good stretch of the hip flexors as well. So they're just a few of the common things that I see that come in when people have running pain.
Yeah, sweet. I was going to ask which one you saw more, the posterior or the anterior, like the forward or backward tilt of the yeah. No, that's and what would you put that down, like more to, like that's the position that people are sitting in, and you know, even runners can overdo it because those hip flexors are tighten up as well and get stuck in that position too.
To be honest, it's a good position biomechanically for a body to get into anyway. Like when you have a look at a lot of sprinters and even people like Eliud Kipchoge, the guy who does who did that under 2 hour marathon, which is just nuts. Haven't had a chance to have a go of the Kipchoge challenge. Put the treadmill on for 21 kilometers an hour and see how long
you can hold it for. Yeah.
Crazy. It's crazy. Anyway, so you see a lot of these guys and they actually do have that pelvis that tilts over because it's an advantage. But also, if it becomes too much, it jams up the pelvis. And it's usually seen, like if you're someone who likes to exercise a lot, or for you guys, like you're in the military, you're doing a lot of walking, pack marching, running activities. It's a part of the culture, but it lends itself to a tilted pelvis going the other way. So definitely look at the hip flexors. Look at your core as well, because your core helps tilt the pelvis the other way. And then look at glutes, because the glutes help bring that pelvis back in, so strengthening that too.
Yeah, and like the simple little what the lower cross syndrome. That's what it's called. And
yeah. We've got one for the upper part too.
Yeah.
With office workers where we end up in this posture. Yeah, it's called the lower cross. Yeah, and so it's that crossing of muscles where you get weakness through the gluteals, weakness through the abdominals. So there's that cross that comes up like that, and then you get your tightness through your back muscles, or they call the erector spinae, because you're in that bow position all the time, and then you get the tightness through the hip flexors as well.
Yeah.
You can think of the hip flexors like they start at the front of your hip here, and they actually connect to your back. And when they're tight, they're almost like with your back, like an archer pulling back the bow and bending the back, and that's literally what they do when they're super tight.
Yeah, and that lower cross, like for people that and it's a simple thing for you to just look at yourself side on in a mirror. And you'll see if you're someone with your butt sticking out really bad, like it's really pronounced, then yeah, you'll see straight away that heaps of people, I've got it. And if you're not aware of it, then that's when it can become an issue and you're not actually working on it. But yeah, what I've found is just having that lower cross, like the idea of, your glutes and your abs are weak, they need to be strengthened, your hip flexors. And so with that idea in your head, hip flexors, obviously, definitely stretch them. What's your thoughts on the lower back? Stretching that as well?
Yeah, stretching that. You can do a lot of mobility into that. I usually find with a lot of the people that I see, it depends. Like I'll see a lot of people, guys and girls, who have this issue, but generally don't have the tight aspects. Like you'll have a look at them and they'll be super flexible. Like they'll be able to, like you'll get them to extend their back and it'll just go bang and they'll be at right angles. Or you'll get them to turn the other way, which you'd expect to be tight, right? Because it's like the back muscle should be tight because it's that lower cross. So it lends itself to the back, but then they're like bang and they're like 12 centimeters in front of their toes when you do a sit and reach, and you're like, okay, well, you're not tight. You look at the hip flexors aren't tight, but it's the weakness as well. So for those people, you really got to look at the stability aspects. And if you know you're one of those people, if you know you're super flexible, you need to work on stability. So working on core strength, working on glute strength, working on abdominal even strength, lots of sit-ups, but really trying to focus on using your actual abs and not using your hip flexors, which is something that a lot of people do when they do ab exercises, particularly if you're someone who if you put your legs underneath or your ankles underneath something when you're doing a sit-up, you're generally using predominantly your hip flexors.
Yeah.
Which, if you think about it, is just adding to your problem of the bowed back because the hip flexors are the tight muscle. So, yeah, definitely for those people, the stability aspect is a really, really important aspect of it.
Yeah, that's something I speak to people about a lot with, because our test for the Army, your feet are anchored, well, for PFA and a few other ones as well. Your feet are anchored and you got to do 100 sit-ups. I think it is the most ridiculous test that there is. It's once you can do the 100 push-ups, it's got the 100 sit-ups. There's barely any core value in it whatsoever. Your neck gets sore and your bloody hip flexors get sore.
Yeah, it should be called the hip flexors test.
Yeah, and that's the thing. And a lot of people get lower back pain doing it. It's because they've already got those issues happening. Okay, so all right. So we know we've got to strengthen up the glutes, and we've got to stabilize the glutes and stabilize the core. We just and obviously stretch the other two. But right now, so how I know we've gone over this with the glutes, they just pop up all the bloody time.
Literally, yeah.
Like they are the powerhouse for everything. So I just want to look at it at a different angle this time. So just quickly brief over a couple of exercises and that. But honestly, if you go back and look at any of our talks that we've had, we talk about a lot of glute work, and we're a bit restricted with time with this. So I'll just try to hit a different angle with it.
Yeah,
so with
cool.
your glute work, are you looking more at trying to build up like load with that, or are you more trying to go along the repetition, like endurance side of things? So for instance, like a big barbell, like glute bridge over something like a single leg, Romanian deadlift for a lot of reps. So, or even, just the stability of standing there and having that instability there. Yeah.
I'm going to try and quote you on this because I think I have it now, but I guess the big thing is that military saying, and let me see if I've got it now, Brody, slow is style and style is fast. Is that it?
You say that every single time, and you always muddle me up, and I always can never remember it. It's slow is smooth and smooth is fast. Yeah.
Oh, I quoted it today, actually. I love that saying, that military saying. I quoted it to a patient today. I'm like, oh, it's a military saying,
Yeah.
and it's popped up again. And I was like, but that is 100% correct for glute rehab with this.
Yeah.
Slow is smooth and smooth is fast, because we want to help with activation of the glutes. And I want to give you another sort of little practical analogy. So if everybody just stands up real quick, or you can do it lying down. It's just not as stand up. And what I want you to do is turn side on, and I want you to squeeze your glutes for me. And if you can, have a look in the screen. So I'm going to squeeze now, and you'll just see my back tilt down ever so slightly when I really squeeze in. Now what I want you to do, I want you to stick your bum right out, and I want you in that position to try and, without moving, try and squeeze your glutes, and you'll find it's close to impossible to do it like that. And so the reason I did that was because the majority of people, when you get them to do, if someone gets a lot of lower back pain, they have that big anterior tilt, you get them to do a glute bridge, and they extend right through their back. And so they don't actually activate their glutes, when the whole idea of the exercise is trying to strengthen the glutes, because like, oh, we got back pain, let's strengthen the glutes. And they just extend through their back the whole way. And I wonder if I actually do have... Maybe I'll show you. So we're down here, our legs are in. Instead of coming up to our hips, what you see these people do, because they're very flexible, is they'll just go like that. You see that big bow in my back there. And what all I'm doing is adding to the problem, activating my back muscles, which is just jamming up my back further. So what you want to do when you're doing a bridge is you want to make sure you tuck the pelvis right under if you have back pain, and you squeeze up with your hips. So right there, I'm at about full hip extension. I can't extend or only slightly extend my hips anymore. If I go any further, it'll all be from my back. And so it's just about actually first doing the slow is smooth and smooth is fast principle, working on not too much weight and what's called motor control, or trying to get the muscles to activate that you want to activate. In this case, it's the glutes and a little bit of the hamstrings as well. You will still get a little bit of back activation, but essentially doing that and then starting to build up into the sort of higher loads as you go with that. Also, single leg bridges are really, really good for activating and getting the glutes active as well.
Yeah, awesome.
Yeah.
And with your core, so I'll ask one more question, and I'll quickly go across to everyone to see if they've got anything before we wrap it up. But yeah, with your core, I loved how you said it was the muscles underneath the six pack, because your six pack isn't really the core. It's a part of the whole structure, but it's the whole underlying stuff that you need to work on. So yeah, you know, doing 1,000 crunches isn't working your core, it's working your abs. So with you, are you more like anti-rotational type exercises rather than, you know, flexion and rotation and all that sort of stuff, or how do you approach it?
I usually test the core in. I always like to test the core in a dead bug position. You will use a little bit of hip flexor, but essentially you can test what's going on with the back. And if you haven't done dead bug, I won't model it today, but just look it up on YouTube because it'll show you how to do it.
Yeah, 90% of them have got it in there, I reckon.
Yeah, probably in the vault. Yeah. But yeah, I usually test. The dead bug and just see where people are at. Can you maintain your pelvic control? And that's what the core essentially helps keep the pelvis aligned and essentially the spine, because the pelvis is the center of your mass. So if it's moving, so is your back essentially a lot of the time. And so the core muscles, they're wrapping around and they're just holding everything steady. And if you're unable to do that on your back, then when you've got something loaded, like you're doing a squat or a pack march or whatever, like if you don't have the core strength, even lying on your back, then you're going to struggle when you start doing that. So that's what I look at for core. And then I usually test for rotation what's called anatomical slings, or they're muscles that join up together to help the body work with rotation. And they're involved in everything you do. If you throw a ball, you're using some of your slings for rotation, rotating when you throw the ball. Same with when you're running, you're using another sling that is with your glutes that intercepts with the opposite lat as well, and that helps you run. And that's why you see sprinters, like they'll be big downstairs, but they'll also be pretty chunky upstairs as well, because they have that good transition between their upper and lower body when they sprint. So I'll usually test their rotational strength as well, and if I find that there's an issue, then I'll make sure to add some, like you said, anti-rotational exercises.
So and like Ryan was saying, those anti-rotational stuff that we're talking about, it's where you hold, like your midline is being stable while, you know, you're changing the stimulus from the outside. So for instance, like if you're in a plank, it's like anti-flexion, anti-extension. So you're in the plank, making sure you're sitting in that position. Your body's stopping your pelvis or anything from moving around, and same as in the dead bug. And then you can lift a hand up and your core has got to stop your body from twisting and doing all the stuff that you don't want it to do in those positions. And with the with the dead bug, when you test people, are you talking, you know, you move a leg and a limb out. So you all know what the dead bug is. When you're laying on the ground and you look like a dead bug, and then you either do opposite arms, opposite legs, or you do both arms and both legs. So with your test, Ryan, do you like move a limb and then see if their pelvis tilts forward, and that's how you test with that sort of thing to see if they got that stabilization?
Yeah, I'll do that, or depending on where I am. If I'm in the clinic, usually I use a pressure gauge, so I stick a pressure gauge under their back.
Oh yeah,
Actually, you'll actually see the needle. So like when you get your blood pressure tested and you've got the needle, you pump the needle up, you put it under their back, and if their pelvis shifts, you'll actually see the needle.
That's cool.
And that's how you can test that the core is not activated, it's not able to hold the position. And that's where you'll start from the easier version of the dead bug before that, or the easier plank, and then you can kind of work up from there as you go.
Yeah, awesome. Okay, just between the group, have you guys got any questions at all that you want Ryan to quickly answer for you? At all? No? All right, sweet. So awesome. We've got a bit of time for a bit of a wrap up, just to make sure everyone's full bottle with what we what we just said. So yeah, just wrapping it up, like the key points, Ryan, like yeah, what are the take home things if someone is finding that they are, you know, they're going for a run, or even, and like I put this up in the group before too, if you are finding your lower back is actually getting sore while doing these core movements, because it's all related. If you haven't got that pelvic stabilization, then it's gonna lock up in that same position. So yeah, Ryan, what's sort of their take home? You know, how do they know whether they're someone with the tight hamstrings or the forward tilt, and some sort of things to go home with it?
Have a look at your posture. Have a look at your posture in the mirror, like Brody said. Have a look from the side. If you do find you've got a real big shift and you can see a big curve in your lower back, and you know you get lower back pain already, it may be because you have that issue where that you've got that lower cross syndrome, or where you've got the muscles that are too tight in your hip flexors, in your back, and there's weak muscles in your abdominals and in your glutes. So you need to work on stretching the tight things that I just said, and then strengthening the weak things, strengthening the abs, strengthening the glutes, and then working from there. If you're somebody who has no curve, chances are you're putting a lot of extra stress through your intervertebral discs, and that is also an issue as well. So you need to work on some mobility exercises for your hamstrings, some mobility exercises for your lower back as well, to actually help bend a little bit better and move a little bit better. Lastly, one thing I just didn't touch on, and really importantly, is the majority of people when they run, if you were to look at their what's called cadence, or how many steps they take in a minute, the majority of people take too few steps in a minute. So essentially when they step out, they're overstriding, so to speak. And as they're overstriding, for every action, there's an equal opposite reaction. I remember that back from high school. But if you stride out in front and you hit the ground ahead of yourself, the force gets pushed back into your body, which is super inefficient for running, and also lends itself to a lot of injuries, back included. So they reckon the majority of people worldwide that run, and there's apparently like 200 something million people that actively run, they do around about 150 to 160 steps per minute. But we really need to be trying to aim for about 180 to 185 steps a minute. There's a cool app at the moment out called Run 180. And if you want to try and see what it feels like to run 180 steps a minute, you can just download the app. It's got a really cool little beat, the music beat that goes to it. And they just take you through like a minute on, a minute of walking, a minute on, a minute of walking, just to get you used to it. And you'll be surprised. Like I know when I did it, I thought maybe I was getting close to 180 because I've never really had too much running related pain, but definitely I was well off. So yeah, it's a weird feeling, stepping a lot more, but very beneficial. The one thing that I felt like when I was doing it is I felt really light and felt a lot more effortless to run. So that's another thing that you could chuck in there too.
Yeah, definitely. And yeah, usually people that are overstriding are usually heel striking as well. So it's all just shock loading back up. Yeah.
And just lastly as well, I run a podcast as well called the Fit After 35 Project. And the next person who I haven't introduced yet, but she is a physio that works for Google in Australia. And she is the lady that designed that app that I just told you about, but she has been spending the last 15 years working on running related injuries in physio. And so she'll be a really, really good one. It comes out in about 2 weeks. She'll be a really good one if you guys want to learn a little bit more about running related injuries and cadence and stuff in sport and fitness and the military. So that'll be good.
Oh mate, we're all running. And Jess had some issues lately with her running, and yeah. So definitely that'd be super handy for a lot of people, because that's a big thing that people don't look into, is the technique side of things, and it's massive. It's a big part of it. It saves a lot of injuries, and it makes the movement a lot more effortless, like you said. So you can go longer, harder, and get better results. Awesome. All right. Well, yeah, thanks for spending a little bit of time with us before you have to go off and do some more work. No, that's, again, as always, yeah, you jump on here and give us a massive amount of value, which is awesome. So yeah, thank you again for coming on, and yeah, listen out for his podcast. He's told me about some really good ones coming up. So I'm keen to listen to him myself and get that info in. Yeah, thanks to everyone turning up. It's really good to see you on here live and taking this opportunity. Yeah, hopefully you've got some value out of it. So Ryan, until next time.
Awesome, guys. Thanks for having me, and I'll see you again soon.
All right, mate. Catch up. See you all later.